Namaskar. A very good morning to you all. Happy Sunday and welcome to Apollo 24/7's Health Hour. Health Hour is a show where we bring you experts from Apollo hospitals to this live show where you can ask your queries and we shall bring an answer from the expert. How do you need to join us to ask a question? You must be watching this on Instagram, Facebook, and YouTube as well. But if you have a question or a query to be forwarded to the expert who's going to join us today, then please jump on to the YouTube chat, type your question there. From there, I shall pick questions from the audience and place them before the expert. And also on the show, we are going to have a health quiz where you can win prizes from Apollo 24/7. So I urge you all to download Apollo 24/7 and utilize the coupons and discount vouchers that I give away on the show as well. तो चलिए आज के टॉपिक के बारे में बात करते हैं. Today we are going to talk about a very interesting topic: how to prevent diabetes. Well, आपने सुना होगा how to manage diabetes or living with diabetes. You must have heard, but how can we prevent diabetes? What all things that we need to do to prevent diabetes? Today we are going to consult the specialist from Apollo 24/7 app, Dr. Srividya Kalavagunta, who is a digital health expert and a family medicine specialist with an experience of more than 10 years. She can be consulted for chronic disease management like diabetes, thyroid, hypertension, etc. and also infectious disease. She also is an expert of family medicine and primary care. She has been awarded and achieved multiple publishing of papers from correlation between body fat estimated from BMI and bioimpedance analysis from JEBMH March 31st in 2021, and she is also a member of Association of Family Physicians of India and Telemedicine Society of India as well. Here we have Dr. Srividya Kalavagunta joining us. Good morning, ma'am. Welcome to the show.
Good morning. Thank you for having me here.
Lovely having you on a Sunday morning, ma'am. I understand that your work is mostly because you are an expert from Apollo 24/7 and you'd be the first person, somebody who requires, as a family medicine practitioner, you would be the first point of contact for many. So it's lovely having you here.
Thank you so much. It's always nice talking to the patients and answering the questions and, discussing with them.
Yeah, based in Bengaluru, hailing from AP and Telangana, Dr. Srividya can speak Telugu and a bit of Kannada, but predominantly we'll keep the discussion for larger viewers' benefit in English and a bit of Hindi. And in case somebody wants a question to be answered in Telugu or Kannada, please do mention. We'll make sure that Dr. Srividya answers in your language. Well, Srividya Garu, let me start off with a basic question. Diabetes is alarming, impending. It's one looming impendence on our country. We are heading towards the world's next biggest diabetes capital. So tell me one thing, why should I get scared of diabetes?
Because diabetes has become almost, it is an epidemic in India, and as you said, in diabetes has been increasing a lot, and now we have a lot of family members having diabetes, and so the risk for us having diabetes is higher, and we need to the food, the high calorie intake of food we are having is also changed, and that is also causing alarming rise in diabetic people. So I think if diabetes can be managed well, and if early we know the risk factors, we understand them, and we are able to curb them at initially, then it needn't be feared so much, because it is a controllable disease. We have had enough research around it, enough guidance around it. We just need to make it a daily lifestyle change, daily activity, not rather than, hey, today I'm going to reverse my diabetes, in a month, 3 months I'll reverse my diabetes, I'm good to go, no diabetes. No, it's a daily step. It's a daily step towards health, how you manage it and all that. And if you're able to do that, there's nothing to be very scared of diabetes.
Right. So while saying that it's a daily management, can I also ask you one question, that are there a certain group of people who are more prone, or is there any lifestyle or a kind of behavioral pattern that is established or has a link to show that these people or this set of people can be diabetic in future?
Yes. So pre-diabetes is a condition which leads to diabetes. So that the pre here is the stage where you can prevent the diabetes. So you can see it pre-diabetes as
It's not like the stage before diabetes. So it's a
it
preventable
is a
diabetes.
stage before diabetes, but if we see it that way, it is a stage where you can still prevent the diabetes, right? You can reverse it. You're still not reaching where your pancreas are not, able to keep up. So the risk for people who are at pre-diabetes mostly undiagnosed, but we can see that when you're at a different risk factors to it. Primarily, they're modifiable risk factors, non-modifiable in the sense age. We cannot do anything about it. With age, we do. And genetics, like, my parents are diabetic, or, my sister is a diabetic. The chance increases with the closer the family member and compared to a distant relative. But there are modifiable risk factors, modifiables, ones like your weight. Weight is a very important way. So your BMI, body mass index, should be below the expected for your height and weight. So you should know what your ideal BMI is, and if you're on the higher side, you're on the overweight or obesity side, there is a higher risk you develop into diabetes. And especially if you can reverse this, there is multiple studies around this, that hey, if you lose 7 to 10% of your weight, and if you are in your ideal BMI, then the chance of you reducing diabetes over the 10 years is a X percentage you can reduce, and there is lower chance you progressing into diabetes. So there is overweight, there is also your diet, your high calorie rich foods, very carb heavy
Yes.
foods, like
Yes,
these
yes,
days you
and
see a
that's the
lot of
generation. We are living at a generation where even a simplest of the roti can be made into a complex gastronomical
yes.
delight with added rich fats and carbohydrates.
I think we are also spoiled with choice. There's a lot of choice out there, and we want to experiment everything. That's is everything can be done in moderation. I am not saying the only right way is don't eat at all. So there are ways, how you can eat something. Like, you can see, hey, I want to eat my favorite food. Like, in Apollo 247, we have built something, know your food. So which says that I can eat my favorite food or the flavor I want, but how do I, customize it so that my sugar doesn't raise into it. So there are ways you can do also. So activity is one more thing. If you are leading a very sedentary life, that also leads into, I think currently, because of our work life, and people having smaller closed spaces, enclosed in longer, and timings of work, and also in general, because you sit at home, you are easy to watch TV and all that, and a lot of vehicles come in, so you don't walk to places and all that. The small simple steps have changed, and lives have become very sedentary for us currently. That's
Correct.
also these
Be
are the things.
it work or education or comfort, whatever that the reason be, we are getting sedentary as a community. Well, I ask my next question, Mr. Jafar, can we have more details of your question? You have placed a question, जैसे आप कब से डायबिटिक है, आपका शुगर लेवल्स कितने होते हैं, एंड आप कितना क्या लेते हो उसके लिए, and all these details if you can give, it will be nice. I request all the viewers to type in as much as details as possible, so that Dr. Srividya can answer your questions. I will be taking up your questions very shortly. Before I move on to the audience question, one quick thing. Now that I see a lot of advertisements that claim मेरा diabetes reverse हो गया. So, can a diabetes be reversed? What can be managed? What can be reversed? And what can be prevented? Some light on it, please.
Sure. So the risk factors can be, knowing pre-diabetes can be reversed. If you, because your pancreas are still not affected, you're still not at a high level of sugar weight that is there, so it can be reversed. Pre-diabetes can be reversed, whereas diabetes, your HbA1c, your average blood sugar, your blood sugars can be reversed to normal. But your diabetes overall, you are a diabetic, so you can reverse your blood sugar values to normal, but being a diabetic, you have to control it lifelong. So saying that, hey, my blood sugar is normal, my HbA1c reversed to less than 5%, and going back to eating a lot of changes you made to come here, if it is done, that is not. So there's a lot of market when people are saying diabetes is reversed, my diabetes is reversed. Where what they mean there is their blood values, blood sugar values have been reversed. It's not the diabetes condition as reversed. I believe in personally, once a diabetic, always a diabetic. But once a diabetic, it's not that you need to take medicines all through your life. So if I can keep my diabetes in control with my lifestyle changes, then it is as good as reversed. I just need to be careful and managing it lifelong. That's all.
Very wonderfully put answer. So once a diabetic understand that your body does not have enough insulin to manage you, so whatever you've been doing to get here to this value of blood glucose, you need to continue that, and that should be your mantra. Well, let me start taking the questions from our registered users. So what is registered user naam nahi hai, what is pre-diabetes? He wants to know about that. And also, uh, all right, so let's start with that, man. So what is
So
pre-diabetes?
pre-diabetes is a condition where your blood sugar levels are normal से ज़्यादा है. It is little higher than normal, but it is not high enough to be diabetes. So if we
Hmm.
say fasting blood glucose, a blood glucose more than 126 plasma or venous blood glucose more than 110, we say is diabetes. This person is normal is below 100. He is above normal but below. And postprandial after eating blood glucose is less than 200 but more than 140. Is someone, he is at a risk to diabetes. If these long standing sugars go ahead, your insulin resistance increases. It affects how your insulin is secreted in your body and all. So pre-diabetes is a stage between diabetes and being normal. Your blood sugar is also between that level.
Well, and this is the stage where you can catch hold of your diabetes. This is where you
Yes.
can regulate yourself so that you don't further fall into the bracket. If I'm not regulated a pre-diabetes, where might I land? What can be the next stage?
So if you're a pre-diabetic, think of the road where you there's a fork in the road. Okay, I do my lifestyle changes. I make sure that hey, no need of drastic changes or fad diets and all. Just have a regular activity of 150 minutes, per week or 200-300 minutes, and have a good diet. I'll explain more when the diet
Yes.
things up. So have a good diet, good activity, and you make sure your life is not sedentary. You make those small simple steps to life, and be mindful of what you are eating. Being mindful, manage your stress, and have a better sleep, 6 to 8 hours of sleep. That is the road which leads to no diabetes. Then you don't get diagnosed, you don't worry, or you procrastinate thinking that it's okay, it's pre-diabetes, abhi to time hai, then I'll wait on this and all that. That's when you land into the diabetes. I think that's the road, the patient has to decide. Or now, because he's still not a diabetic, maybe the user have to decide where do I want to go.
Yeah. So before I go further to the audience questions, type 1, type 2, these are the diabetes that we keep hearing. So what is a type 1 and what is type 2?
So type 1 diabetes is very less percent. Almost in the diabetic part, it is only 2% of it. This is little on the younger population, and also for people who have the pancreas doesn't secrete enough insulin. So previously it is also known as insulin dependent diabetes, because you need insulin always and all that, and your pancreas are not in a function to release that insulin that is externally given to you, so to manage. It is mostly genetic related, though management can be other ways, but this is genetic related. Type
Okay.
2 diabetes is majority of it. It's like 95 to 98% of your diabetes in type 1, type 2 is type 2. This is more where your insulin is resistance. So your body, your pancreas do secrete insulin, but it is not able to keep up to the requirement, because you're eating a lot of high sugary foods. Like your blood sugar is always high, and how much insulin can pancreas do? And sometimes because of your overweight, your visceral obesity is high, means your waist around waist is high and all. There are few things like overweight and all this cause insulin resistance. So the body, though we have insulin, the cells don't accept it. So because of that, the glucose doesn't enter to the cells, and you have continuous, it's a cycle. Because of the high blood glucose, your pancreas try to release more insulin, and because sugars are continuously high, the insulin resistance occur, and the cells may the sugars don't go. That's a cycle. So I think
Yes.
this one, you can type 2 can be still prevented, and it is little later in the age.
Right. So we've understood that type 1 and type 2 diabetes may type 2 diabetes is more common. And if you're pre-diabetic, if you do not take care of yourself, you might land into a type 2 diabetes as well. Next question, Srividya Garu, is Tarun, 35-year-old. My father is diabetic, and how can I prevent myself from being diabetic? Also, Mamda, who's 25, she says I have hypothyroidism, which comes. My mother and father are diabetic. How can I take care of myself?
In both the cases, they're young. So good that they want to know early, where do they stand. And the best thing here would be one when one parent is diabetic, the risk is there. When two parents are diabetic, the risk is a little higher. When your siblings are diabetic, the risk is much more higher. And when your twin is diabetic, it's much, much, much higher. So it's distantly relative. In these cases, both the parents are diabetic in one, and one has this thing. They need to check their blood sugar, Jansi. It's easy as that. They need to just monitor one fasting blood glucose, a yearly checkup, may where once is enough, because one of them is 25 years. Usually, we recommend about 30 or 35 years if there is a risk factor to yearly have blood glucose checked. Given she's 25, she can get her blood glucose checked and she can see how it is. But I would like to tell them that, hey, please do understand, once your blood glucose is negative and you're not diabetic, doesn't mean that you're lifelong non-diabetic. It is a continuous process. You need to annually check, or check it once in 2 years when you're young, and no risk factors, just to see that you're not developing to that, because there is a risk factor, right? There's a family risk factor.
Right. So Mamta is 25 and she's already hypothyroidic. With both the parents,
Yes.
in this case,
Yes.
are diabetic. So you would advise her to start off her basic blood tests at what
Yes.
point and repeat it how long? What duration?
So first time she need to check now. She can check how is her fasting blood glucose alone would be sufficient. And if it is normal, then nothing to worry. Then she can check it every year once. And if it is fasting blood glucose is little on the higher side, she's on the pre-diet because of the hypothyroidism or the risk factor from, then she need to check her, HbA1c. Along with that, she needs to check her postprandial blood sugars also. If all in control, Jansi, once in a year should be suffice because of the hypothyroidism and parents being diabetic. If not, if anything is altered, then she needs to make those lifestyle changes which we discussed before and check it again once in 3 months.
Absolutely nice. And then one more question here. You've been mentioning that we have to monitor our blood glucose at least once a year. So,
Yes.
in case that I don't have anybody in the family who is known to be diabetic, but I'm an individual who wants to check. What are the basic tests that I can check? Are there any other conditions of the body like cholesterol or liver function tests to be done so that I understand there is a link between them and my diabetes?
Sure. So, as a primary physician, I would recommend anyone above 30 years to get at least annually one checkup. Okay. If any risk factors are there, like overweight or, a family history of diabetes or cholesterol or these things, then, from about 25 only. And based on their reports, like if you have a cholesterol, this thing, then we would recommend every 6 months again to check if your cholesterol is in control or not, where exactly you stand. If we have started you on medications usually, then we would ask every 3 months to see if the medication has improved or not. So your question wise, Jansi, no risk factor at all. Yearly once, the basic test could be your fasting blood glucose, your CBC, so you don't have any anemia or hemoglobin, everything is normal, and also your liver function test, and your cholesterol and all that. Your triglycerides, your good cholesterol, your HDL, which is, and your bad cholesterol, your LDL and VLDL, we will check.
So
And
these
along
are
with
the
that, routine also,
please go along
urine
with that.
routine also, one urine routine also, urine
Okay.
analysis to just to know your urine glucose is high, any infections, everything is good, you're hydrated well, and all that as well.
Great. So these are the tests which are available on Apollo 24/7, and these are all
Yes.
physician curated tests. And one can, any test panel that you can quickly recollect that they can, a simple diabetes panel, or do we have a random panel?
We have a diabetes panel, we can have that also. Young female and male ones also we do have, and they can select those also. Based on the age, we have panels, and based on the condition, like diabetes, early diabetes panel and all that is there.
All right. So here's the next question, ma'am. Naveen Batra, 50-year-old male. feeling thirsty, and my fasting blood sugar varies from 90 to 107. How do I control? Because this is a registered user, I'm not sure if Mr. Navneet Batra is here on the show with us. Any additional details that we require might not come through.
Jansi, I missed you for a minute. 90 to how much was it?
The fasting blood sugar is 90 to 107.
Okay. So, as we said, normal fasting sugar should be below 100. 90 is good, but there are sometimes when it is 107. So, we need to evaluate if he has any risk factors. Then I would want to see his HbA1c also, because fasting is depends on what you ate before day, and you know how late you had your dinner and all that also. Given that he is between 100 and 107 also, a HbA1c tells us 3 months average blood sugars. And also maybe once we know his how he is managing post prandial also, after eating also, if it's below 140, then we are not worried, he is good.
Ah, interesting. So here's Zafar Chaudhry, age is 35, pre-diabetic, and he feels that there is a sudden jerk in his body. And what is this? And also, would you want to establish, if uncontrolled diabetes is there, what can happen, nerves and other neuropathy issues?
But given he is in pre-diabetic, having a neuropathy issue because of that would be rare. If uncontrolled diabetes is there, your sugars are much higher. Your nerves become, we called it diabetic neuropathy. Your nerves become very lax. So you won't feel, you kind of feel pins and needles sensation, or you're like walking on a cotton pads and all. So also you need to check in them, because vitamin B12 deficiency is also common. Diabetics, we do check vitamin B12 as well, and maybe supplementation would do, and diabetes control would do. Given Mr. Jaffer is a pre-diabetic, I think he need to follow up at the hospital and check with his doctor to know why these drugs are evaluated, and if it is because of sugar, is he still in pre-diabetic stage or is it past to diabetic stage?
Progressed. Very
Yes.
important. From here, I would want to place a question, which is most of us are not actually following it up, and we take it really very light. कि एक बार हमने डॉक्टर से मिल लिया वो बस है life long. So we continue with the same old prescription. We think that it's not important to go back with the newer values. I think these are long-term issues, chronic issues, which require a physician all the time as a guard by you. And I think it's more important to have a great friend in your family physician than anybody else. Would you want to reiterate on that?
So I would always inform my patient, please do understand the chronicity of the symptoms. These are called chronic conditions. That's why you need a chronic management. That's why you need to follow up, how it is going. You needn't meet the doctor in person. We have these online consultations. We have, you can follow up with your doctor online and all that. And every 3 months is at least when you have to follow up, until and unless your sugar is absolutely good, you've been managing well. There are some conditions where say 6 months follow up also for
Nice.
diabetes.
So it's a
Not just
relationship that
diabetes.
we need to maintain.
I'm sorry.
It's
It's for any chronic conditions. Diabetes, not just diabetes, your cholesterol issues, your thyroid issues, all these as well.
yes, and then it's not that one old prescription कि आपने पकड़ लिया कि चलो डॉक्टर साहिबा ने ये प्रिस्क्राइब किया ये 1000 ये 100 वही लेते जाओ. No, your body might have a problem with it. So that's
Glucose
something that would
monitoring
affect
should
the
be done
diabetes.
more commonly. Yes, you needn't do all the tests also. At least just your random blood glucose monitoring and seeing how it is. It cannot one prescription or prescription validity is always written on the prescription. The doctor writes it 3 months, 2 months, or 6 months. Based on that is when we have to follow.
Correct. So here's the next question, Neeraj Gogia. I want to know the importance of lifestyle and lifestyle do's and don'ts to manage diabetes.
So lifestyle wise, as I said, a mindful eating. When you look at your plate, it should have half of it of vegetables and fruits. One quarter of it should be your protein. The other quarter of it should be your whole grains. Why do I say whole grains? Because whole grains are good in fiber and it doesn't spike your sugars very soon and all, compared to a white rice or a white bread. You can talk to a nutritionist based on it, or you, as I said, there's a new your food, you can see how your food is, what are the contents of it, what are the macros of it, what are the micros of it, and you know it. So a mindful eating is important. As simple a plate it is, you have to always make sure that this is there. And also along with that activity, you need to have, for a diabetic we recommend at least 150 minutes to 300 minutes of walk per week. This walk should be in a moderate intensity. It should not be a very low intensity. At the same time, we don't recommend vigorous also, because they are diabetics and they should not have into ketosis and all that. So moderate intensity workout, and along with that 2 days of strength training. This can be your yoga, which improves your flexibility, your balance as well. Or it can be simple, your hand exercises, arm stretches, and elderly people sitting in your car, leg stretches and all that. Along with that, we also recommend good sleep, 6 to 8 hours of sleep. And make sure that it is high quality sleep, not just on the bed for 6 to 8 hours would be enough. The quality of the sleep also should be good. And yes, and I think people should start monitoring how they are walking, how many steps you do. People are a lot of
Yeah, most of us have
we
a
recommend.
watch which is monitoring.
Yeah. Even if you don't have a watch, I understand elderly people don't have. You have your phone. Phone tells you how
Phones.
much. Yes, Apollo 247 also we show that how many steps you have done, how many steps you complete. So it's always ideal to monitor how many steps you're doing, and also whether you're meeting that step goal. This step goal can be understood from the doctor. Ideally, we recommend, as I said, 6,000 to an 8,000 steps, depending on the patient also, because someone with a knee pain and all, we wouldn't recommend so many. Or someone who's not doing, who's already active, been so doing a 6,000 steps won't be enough. So for them, we might recommend 8,000 to 10,000 step goals.
All right. So I'm understanding the diet a little more. There's a registered users question. What is the role of gut health in diabetes?
So gut health does help in diabetes. There's a lot of studies coming, but established studies are still not there. Basically, what would I say is how much your sugar absorption happens, what kind of quality food you eat. Is the food high in protein, high in, when you eat proteins which are high in fat and, protein compared to the carbs. I'm not saying don't have fully high, it should be a balanced one. Then your gut works also better, and the absorption of the gut is also better. And when you take fiber rich food, so then your starchy absorption, the sugar absorption of it'll be slowed. So we would recommend someone to have a more protein and a less carb and high fiber diets towards the night, because your absorption of these things will be slower, and you will not go on the hypo or a hyper level in the night.
Yes. Here's a question which has caught up attention of many in the recent times, especially in a population where we are more obese. Ketogenic diet. Rohit Prasad Shah is asking this question. Ketogenic diet, does this help us in diabetes and management? I am an obese male, 30-year-old.
So, the idea of why diet helps in diabetic is your weight management helps diabetes. Being in an ideal weight range helps diabetes. What gets you there should be something which will be long lasting. Whether it's keto, paleo, intermittent fasting, there are multiple diets, and for every person, something works, something doesn't. But I would recommend that choose a diet which you can follow lifelong. It cannot be that I do keto for a month, I feel it is very difficult, I won't be able to manage, and it's not something sustainable for, at least for the patient population we see and who are obese and likes foods and all. It's not sustainable. Find a diet which is sustainable, which works for you in long term, and that also helps you in diet. Being he especially, he said he is already in the obese bag, having drastically lost weight can have a higher chance of drastically increasing also. So I would recommend him to sustainably lose weight rather than choose for something drastic and not be able to. Also, there would be side effects of it, right? Sudden hunger cranks leading to overeating and these things. So I believe sustainable eating should be the way, and rather
Hmm.
than any of these fad diets for immediate results.
Right. Amrit Ravi is asking this question. How is Apollo 24/7 app helpful, diabetes app helpful in managing the condition? So, do we have a feature or something in the app?
Sure. So we do. So I do recommend few of my patients to use the app. That is, especially we have multiple features. So one of it is blood glucose monitoring. Many users check their blood glucose, don't know if it's high, low. You see, we had questions. This my sugar is like 90, 107. How is it? So we do have a tool where which put blood sugar into it, and you mentioned what time of the sugar is taken. It's fasting or postprandial or this thing. Based on that, it tells if your sugar is high, low, or okay. And also tells you how how can it be managed, and as that as well. And as previously I was talking, know your food, which tells you, I want to eat a food, I'm not sure if it's ideal for my diabetes or not. So it helps you putting that food into it and see how many macro micro unit nutrients are there. Is it ideal for my diabetes or not? And also the best thing here is, a lot of people tell me that they find alternate food choice. See,
Acha.
I can't, if I know it's a bad thing, I can't stop craving, right? I have this craving, I want to eat. So, telling me something else I can eat is always helpful, because I feel happy that I got to eat or the flavor. At the same time, I'm happy I didn't increase my sugar also.
Yeah,
So
so
that's
having an
one.
alternate and having a choice is always great.
Yes,
In the
because we
right time,
live
with
in
the
the
such.
new times where choice is so much. I think healthy food also should have choices.
Yes, Srividya.
So,
So we've left a link to the app, the tool that Dr. Srividya has been talking about. The link to the tool is left in the description box, and we can leave it once again also for your convenience. And who should have this app, ma'am? Is it somebody who has diabetes or who is pre-diabetic? Who should have the app, and how long should they monitor?
So activity part of it is like your Apple Watch, right? You have a watch, you or any watch, your smart watch. So activity part of it, where how many steps you're making, how whether you're reaching it, and how active you are, how many calories you burn. That you can do it a lifelong thing, because as I said, being active it is everything. You can keep checking how we are, or the app can send notifications saying how you're doing and on that. But when it comes to blood glucose monitoring, it is mostly diabetic and pre-diabetics. And also when it comes to your know your food and all that, I think it's for general population. These days everyone is interested to know, hey, I'm eating good food or not food, and having a healthy choice. But especially the blood glucose monitoring is only for diabetics. Like, I'm a diabetic, my sugars are high, I need to. Otherwise you don't need to check your sugar, right? If you're a non-diabetic, your sugars are normal, and your yearly checkup turn fine, why do I need to check my sugar?
Absolutely. Yeah. So Sean David, question here. He has his diabetic. He's a diabetic, and he has his tablet in the morning. For taking a PP test, that's a postprandial test, should I not take the tablet?
I recommend all my patients to take the tablets and get the test done, because no changes in your diet, no changes your activity, or no changes in your medication, because we want to see, we have given you the medication, we want to see how your medication works, right? Your sugar is controlled with medication. The moment you stop your medication and do the test, it's gonna be high. Or you start eating very healthy that day, and next day, because I have a test. I know patients who eat by 8 o'clock, they say I've finished by 8 o'clock. Usually the dinner timings at 10. So do what you're regularly doing. That's what we want to see, and that's how we can improve.
Okay, great. So Lakshmi Narasimha Textiles, the name is Anil, 36-year-old. Ma'am, my blood sugars level is more. Before breakfast 256 and after breakfast 350. I don't know if I'm diabetic. When I check my blood sugars, levels are high, but I don't have any symptoms. So let's understand what are the symptoms that he is looking for and what are these numbers stating.
Okay. So, diabetic symptoms are people feel very thirsty, feel hungry, and lose weight and get recurrent urine infections. But let me start here. Let me stop here. The people who are having high sugars doesn't show symptoms always. It's not a mandate that, hey, we do find people who are completely asymptomatic with high sugar values. The sugar values which he has mentioned are definitely in the diabetes bracket. A fasting glucose, as I said, should be below 100, up to a 120. We are okay up till it is 120 period. And postprandial is 200. He's mentioned a 356 and a 256, which are very high. He needs to consult with a doctor. and he needs to start on medication. Maybe eventually we can discuss how this goes with lifestyle and all that, but he needs to consult with the doctor earliest, even though he doesn't
Yes.
have symptoms.
Right. Expecting that Mr. Anil would be a Telugu person. ఏమండి మీ దగ్గర ఉన్న నంబర్లేమో మీరు డయాబెటిక్ బ్రాకెట్లో ఉన్నారని డాక్టర్ గారు చెప్తున్నారు, మీకేమో సిమ్టమ్స్ లేవంటున్నారు. సిమ్టమ్స్ లేకపోయినా కూడా డయాబెటీస్ ఉండొచ్చు, అర్జెంటుగా డాక్టర్ శ్రీవిద్య గారికి మీకు కలవాలి అనుకుంటే కనుక వారి లింక్ ఇక్కడ పెడతాం చాట్ బాక్స్లో. ప్లీజ్ గో అహెడ్, బుక్ అన్ అపాయింట్మెంట్, కన్సల్ట్ అ డాక్టర్ ఫస్ట్. Yeah, and Pratap Reddy Gavinolla. Pratap Garu, he is a diabetic from past 22 years, also having hypertension. HbA1c is at 9%. Fasting blood sugars are at maintaining at 172. 56-year-old, sedentary lifestyle, insulin based 100 unit. How to reduce the HbA1c levels?
So he's already having insulin at 100 units, and he clearly mentioned in his comment only that I have a sedentary life. So there are two things, right? So imagine diabetics is medication is one part of it, major. Along with that, though that's only one pillar to it. There's diet, there's exercise, and there is sleep also. The lifestyle forms the other pillar as well. These three things. So medication wise, he's already reached there, and 100 units. There still can be more medications. You can start with medicines along with insulin. You can start with long standing insulins and all that. But when you know there is a sedentary life, this cannot keep going up to an extent, right? You should be a balance of both lifestyle and medication. Otherwise, how much ever I will reach a thing, and someday there is a chance of hypoglycemia when you're very high on medications and all that, because that day you're fasting, or your dinner is delayed. So it's always, he mentioned that he had a sedentary lifestyle. I would recommend him to start walking, start a minimal exercise, and know how much he's able to walk. If he's not able to walk because of his knee pains or anything, sitting in a place also, you can do some stretching and yoga. I mean, minimal yoga, like stretching exercises and arm twists and leg twists kind of a thing, sitting at a place, and eventually start walking, and have a healthy diet, low sugars and all. He sugars is 170, fbs is very high with 100
Yes.
units insulin. So he needs to make these changes and also follow up with the doctor for medication change.
He anyway is under 60 and he still needs some more effort to push his diabetes under management. So there are, as you mentioned, ma'am, age as a risk factor. Here's a question, Mr. Krishna Rao, 71-year-old male. He is diabetic. Medication mandatory? Is medication mandatory for lifelong if his sugar level is in control?
Jansi Garu, as we discussed early of this meeting, right? Whether diabetes is reversible or not. In that, I said, if your sugars are in control, there's no need of medication, right? And we see that your HbA1c is less than 7 and your sugars are in control. Why it would be there made a medication? But the follow-up should be regular. Just because the medication is stopped, they should not think that I'm non-diabetic and I won't follow up, I'm good to go. It should be, follow-up should be there, seeing that your HbA1c is always in control, your sugars are not raising up, and there's no mandate that you have to take medication lifelong, as well as you can control your sugar.
So here there was an interesting observation, like you've said. I know a person who thought that they have reversed their diabetes, that their blood sugar levels have come down, and they thought they were quite normal, and they started to, as you said, gone back to their previous lifestyle and did not bother to check. And when it came back, because it was quite a huge whatever burden that the body had gone through, they could not control it. It was very bad after it had come back. So once you think that it's gone into remission, how often one has to monitor this?
It depends. So initially in the remission period, we ask every 3 months, because we still want to see how their HbA1c is maintaining. Maybe after 2-3 months, two HbA1c reports are normal, then we ask for a 6 months, and if they're good for a year, maybe a yearly ones also. It depends on patient to patient, and previously how often they came back from remissions, and also how they're maintaining their current lifestyle.
Absolutely, Yes, yes. So it's not like मेरा हो गया, मेरा number आ गया, मैं pass हो गया हूँ. I'll require this degree certificate to get into a job. I don't need to worry about it. It's not that.
Mm.
It's not your test report. ये तो हमेशा आपको upgrade करते रहना है. Yeah.
Yes,
So,
definitely.
Prasenjit Karmakar. His mother is 57-year-old. She is also hypothyroidic and diabetic. She's on regular medication. Any additional precautions to be taken because of hypothyroidism? Is there a connection between both of them, ma'am?
So there is a connection, but hypothyroid or Jansi garu మీరు hyperthyroid అన్నారా?
Hypo. Hypo.
Hypo. So hypothyroid low, there is a weight gain, uh, and hypothyroid is also a part of metabolic disorder. Diabetes also forms. What does metabolic disorder mean? When you're on the higher side of your BMI, overweight or obese, these are the endocrine disorders which all come because your hormone fluctuations happen, and there is difficulty. So hypothyroid and diabetes go hand in hand, like diabetes and cholesterol, diabetes and heart disease, and all these go in hand. So when you have high cholesterol or you want to have diabetes, hypothyroid, you tend to check for the other things also. These are all come under a bucket, umbrella called metabolic disorders. So it's ideal
Right.
that he checks his sugar also and his thyroid also.
So here, while we talk about diabetes, I think it's important to talk about hypertension. Sean David is mentioning, is it true that diabetic automatically develops a hypertension and vice versa? Relationship between these two, please, ma'am.
So, as I said, when I was saying cardiovascular disease, hypertension was part of it along with the heart disease. So, yes, there is a correlation, but it's not a mandate that everyone who has a thyroid, hypothyroid has a diabetes, or everyone who has a hypertension has diabetes. There is a risk to evaluate it. And if your control is better in either conditions, the chance of developing the other is on the lower side.
Okay, so it should be well maintained, and I hope Mr. Sean David is well aware and he is maintaining it. Amrit Ravi, if I manage my weight or diet lifelong as will I still be getting diabetes if there is a family history?
So it all works with risk factors. So if I control your diet and your health, there is no guarantee you won't get, but you can push it as long as this thing. Maybe you reach it. Ideally, if you don't manage your lifestyle and I mean exercise, activity wise, and diet, you might get your diabetes at 30 or a 50, which is pushed to a 80 or a 90. So it's all risk, Jansi Garu. So sometimes, you club too many risks together, there is a higher chance you get it, right? You start removing the risks which are possible, which I was telling, modifying risk factors like, your activity, your diet, your stress, your sleep, and all this, your weight being in control and all that. Then eventually, where the time you reach that end point is further delayed.
Right. So
So it's
it's
a good
best
thing.
that we
Good do.
know that there is a risk factor and you're working against it. And you don't know what's
Yes.
in store for you. So let you work the way that you want to. Leave the rest, Amrit, to to the destiny. That's it. And
But
you
I
work
can
for it.
definitely tell you that your chances will be much lower. Please make those changes. So your chances will be much lower, and your diabetes, you getting diabetes will be much slimmer when you slim down.
Wonderful. Cool. So here's Satyavalli Govindaraju, how to take Dr. Srividya's appointment, which branch of Apollo is she available? Well, Dr. Srividya Kalavagunta is a digital health expert of family medicine. She can be consulted on Apollo 24/7. We are leaving a link for you, Sri Satyavalli, on the chat box so that you can consult her online. Well, here's a question which I think is your favorite question. I'm taking a guess because you would be getting this question more often than what we hear. Ma'am, can I control diabetes without medication?
It depends on what stage of diabetes you are. I cannot say no here because it is possible. There is hope for it, but it depends on what stage of diabetes you are. At an early stage or a pre-diabetes stage, it is possible. And maybe if when your sugars are way high, it's riskier. Why would you want to postpone with non-medication? when you can use the medication, reduce your blood sugars. I have this, as you said, Jansi, this question is very commonly asked by all the users, because diabetes, once they know medication, they know that, hey, lifelong I have to take medication. So, take the medication, reduce your sugars, be in a way, it doesn't, these high sugars doesn't affect your eyes, your kidneys, your, neuropathy, your feet and all that. Once you know you're not in a risk for all this, and your diabetes, the sugars are in control, then, we can think about lifelong with other lifestyle managements as well.
Yeah.
So,
So
it
ये
depends
आपके
completely
हाथ
on
में है.
what. Yes.
Yeah. It's in your hands. Me check only. If you want, if you do not want medicines, then as Dr. Srividya has mentioned, do the things that you will require to go into a remission and maintain it there. Right. So next question is Sonam, who's 33-year-old, female. How do I know that I'm not diabetic anymore? I had diabetes due to pregnancy. Here's a vast gestational diabetes group that we need to address as well.
So gestational diabetes is also a risk factor diabetes, but not everyone who are pregnancy may diabetic tend to continue that diabetes. Very few members only do. First they have to just check how is their sugars as an ideal, like everyone with a risk factor. If their sugars are normal, nothing to worry. Check it every year and see. Um, if not, then we have to manage it accordingly. So gestational diabetes is to understand for the other audience. It's only your sugar levels are elevated during the pregnancy. You are not a diabetic prior to the pregnancy. It is only elevated during. If you are a prior to the pregnancy diabetic, then there's higher chance your diabetes can path also it will continue, because you are a diabetic throughout. So there a very common confusion, because when we say gestational diabetes, very not higher numbers follow diabetes. People will think, okay, I had diabetes during pregnancy, so I'm not diabetic after my pregnancy. No, you have to know the difference. Gestational diabetes is only diabetes just diagnosed in pregnancy, and she needs to
Yeah.
check up to know how she stands now.
So again, there's a large number of women who can be diabetic after pregnancy as well, who cannot be diabetic as well. So it's again how well you monitor your situation. Keep
Yes.
your tests going. Yeah. Next, ma'am, here's a registered user's question. 21 years से ये diabetes से suffer करते हैं and is now on insulin. I'm working in a remote tribal area with a sedentary lifestyle due to my job. And is it possible to reverse my diabetes? And once it is
Control of
insulin
diabetes
dependent,
is possible.
yeah, insulin dependency आ गया है on the shots that one has to take. How well that they have to control this?
So, Jansi Garu, insulin dependency is harder to, control the sugars once they get, if they stop insulin. But it is not impossible. He mentioned there is a sedentary lifestyle, so he should do those changes also. He lives in a tribal area and all that, so I understand that, for him to find equipment and all that would be difficult, but a small walk around the house also would be enough. And having healthy diet in tribal area, you get good vegetables and all that. I assume that have a good colorful fruits, colorful vegetables, and good, you have whole grains also, full rice, brown rice, and your millets and all that, your ragi and all that. Please consume all that, which make the good of where you're staying, and have the food what is possible there, which here would be difficult. And try to control your sugar. You are currently on insulin, do not stop the insulin, please continue the insulin. And maybe the insulin reduction should be done slowly. Once your sugars are, with these changes your sugars are down, then we reduce your insulin also eventually. And maybe in long run we can try to manage it. Yes, reversing your diabetes is not possible, but reversing the requirement of insulin is possible if you control it well.
Wonderful. And as a word of caution, doctors mentioned that the insulin dosage which is reduced should be monitored. It cannot be
Yes,
done by an individual themselves.
not at all.
This,
Because if you feel that their hypoglycemia, your sugars are going down, or you see that we had one of the user who had 176 fasting even with 100 units sugar, your sugars are higher even with insulin. Please do not increase it on your own or decrease it on your own. Always consult before you do these changes, because insulin is the direct purest form, and your body has no
Yeah.
control on how it is. Body is not able to produce insulin, that's why we are giving it to you externally, so you have to follow up with a doctor before you increase or decrease these doses.
Yes, ma'am. And ma'am, here's a registered user's question: can yoga control diabetes and dependence of insulin as well? How well do you recommend yoga?
Yoga can be done. So yoga has three benefits, right? Which I can think of. Yoga is like stretches your muscles. So when the muscles are stretched or when the muscles are in use, the blood glucose intake into the muscle is higher into the cells. So your automatically it is a direct effect that you stretch your muscles, you work out your muscles, your blood sugars are automatically coming down. The second thing
Yeah.
is, with diabetics and elderly, there is a flexibility, stability issue. You tend to fall, you tend to this. When you learn how to balance yourself and all that, it reduces your risks of falls, and you gives you confidence more that, hey, I can, walk comfortably and all that, elderly diabetics. The third thing is
Great.
stress. Stress plays a major role in your diabetes. Stress diabetes can be, possible to with the yoga and all. You can reduce your stress, have a better sleep, and that indirectly also reduces your diabetes. So I recommend doing yoga, but please look out. It is not universal. If you're known to have knee joint pains, and don't, and also if you have very high sugars or hypertension and all, don't do reverse asanas and all, where because your blood rushes to it. Take it slow. Anything, take it slow, see how your body reacts to it, and then slowly improve it. And if you're known to have any risk factors, like like high hypertension, or very knee pains and all, talk to your doctor before you begin these things.
Yeah. A quick question, ma'am. Here, sleep ka effect and stress ka effect that you've been mentioning. So, stress-induced diabetes. This is something that I wanted to ask. Can that be reversed?
Yes, because your stress is what is causing your sugars to be very high, hyperglycemia and all that. It is still it is not a diabetes. The stress is causing it to have it. So if you can control your stress and maintain it, stress is a people think that stress is only a psychological thing. It is not. Stress is physiological also. Stress has effect on your how your hormones are released, your cortisol is released, and these hormones have a direct effect on insulin, and how your blood glucose is monitored. I mean, works in your the system. So I would recommend that please don't think stress is the, hey, I have stress, okay, that is emotional only. If it's psychological, it those doesn't affect it, physiologically affects you. So please have a control of
Yeah.
it, and do things, consult sometime. And
Yeah, there are a lot of questions regarding CGM and insulin pumps or what way newer questions. But I don't think I'll be able to take them here today in this episode because we are restricting to how to prevent and manage diabetes. So for a later day, I'll save all these questions. And also, if somebody wants more comprehensive question answers about how to manage diabetes, we've done a session earlier. We'll leave a link for you there so that you can get your answers from that session anyway. Dr. Srividya, it is an absolute pleasure having you here, and you were very, very graceful in answering. Now I would want you to sum up everything and give us top tips to prevent diabetes.
sure, yeah. So the top tips would be: have an active lifestyle, mindful eating, uh, see what you're eating, how it helps. Medications on time, do not skip your medications, and monitor your blood glucose. See, if your sugars are in control above, and based on that, we can help you. And the fifth also would be: have a better sleep and stress control. And as I said, on 247, we do have these things where you can monitor your activity, your sleep, and your blood glucose and all that. Please check and also consult your doctor whenever you think there is a variation in the blood glucose values.
Great. Thank you so much, Dr. Srividya. It was wonderful having
Thank
you
you.
here. Mr. Syed Abdul Hakim, डायबिटीज उनके सिस्टर के लिए 10 प्लस HbA1c रियलाइज हुआ है. Ma'am has spoken about it in the earlier bunch of the discussion. So Hakinji, this is available as a recording for later also. You can go through, and also there's ma'am's link you can consult too. Thank you, Dr. Srividya, for
Thank you, sir,
being
for
with
making
us.
me feel so comfortable. Thank you, everyone. Please do consult if you have any doubts, and please monitor your sugars. I hope it was a knowledgeful hour.
It is. It was indeed. Thank you. A lot of people thanking you as well on the. Thanks, and that was Dr. Srividya. Here's next session where we do a health quiz. You can participate in the health quiz by typing in your answers on the YouTube chat, and our team will announce the names towards the end of the show, and winners will be selected at the sole discretion of Apollo 24/7 team. And if you're declared as a winner, you need to write back to us with your contact details at marketing@apollo247.com. Gift vouchers will be shared with you. So here are the questions for today. Question number 1 on your screen. True or false? Stress-induced diabetes is reversible. Is that true or false? Question number 2. Fill in the blanks. Diabetes can be managed and pre-dash can be stopped if caught early. Fill in the blank. Diabetes can be managed and pre-dash can be stopped if caught early. Question number 3. Yes or no? Pre-diabetes can progress to type 2 diabetes. Yes or no? So these are the 3 questions. Go ahead. I see a lot of people are typing. And let's see who's the winner for the week. And in the meanwhile, I give you the coupons that you can use on Apollo 24/7. You can use the coupon AskDoc150 to consult top doctors direct from Apollo and get 150 rupees cash back on online doctor consultation as well. And this coupon, in addition to that, we are giving you another coupon, FIRST 3, FIRST 3. You can order medicines from Apollo Hospitals, Apollo 24/7 Pay, and get 25% off on online medicine orders. You can also get 2-hour delivery window too, and this offer is for up to 1,000 rupees order for the first 3 orders that you place. Here's HH247, the code that you can use in addition with the other 2 that we have given. Get up to 199 off on online consultation with Apollo doctors and 20% off on medicine orders. The code is HH247. And WhatsApp पे भी Apollo 24/7 आप use कर सकते हो to book your medicines or tests. You can call or WhatsApp 9355247247 to avail all the healthcare services on WhatsApp as well. Well, I'm waiting for the winners to be announced. While our team selects the winners, next week we are going to talk about the signs of unhealthy liver. What are the symptoms or the signals that your body is giving when your liver health is going on the rocks? 10th September, 11 a.m. That is going to be an interesting session. Do join us next week. I'm not going to be there on the show, but the show will continue. So please do join at 11 a.m. so that Apollo 24/7 can help you with managing your unhealthy liver as well. So I'm waiting for, let's see who are participating. Earth, Teji, Taji, Naveen, Hardayal saying, yes, I see. Abhinav Bhargava, Joseph Raja Pillai, a lot of you are participating, and I'm waiting for our winners to be announced by the team. Here we still do not have the winners, but thank you. Yes, I've got the winners on hand. One is Shravani Naidu, Joseph Raja Pillai, and Naveen. Shravani Naidu, Joseph Raja Pillai, and Naveen, you are the winners for this week. Please write back to us with your contact details at marketing@apollo247.com with all your contact details with the phone number, and your health credits will be given on your Apollo 24/7 app. Thank you all for joining us this week on Apollo 24/7's Health Hour. Next week, we shall see you with a new topic and a new expert. Namaskar. Thank you all of you.